Good afternoon, and thanks for joining us for Living Local, your lifestyle show for everything Charleston and beyond. I'm Ashley Meservy. It's Medical Monday here at East Cooper Medical Center, and today we're taking a look at the joint class that has one mission, and that's to help prepare patients for future joint replacement surgery.
Medical Monday, sponsored by East Cooper Medical Center.
Joining us today, Tom Moriarty, and he is the Director of Rehabilitation here at East Cooper Medical. Today we're actually talking about your joint class and the Comprehensive Joint Program. First of all, let's talk about the Comprehensive Joint Program.
Yeah, the Comprehensive Joint Program is a program designed to manage the health of people who are undergoing joint replacement surgery. It's a good population where we can use standard or emerging best practices in order to best optimize their functional outcome and health.
Okay, and you're a physical therapist, correct? Okay, so talk about kind of all walks of life, people that are coming to this class.
Yeah, so people are coming from all areas of Charleston and right outside of Charleston, and these are people that are having either a knee replacement surgery, a shoulder replacement surgery, or a hip replacement surgery. Mm-hmm. They may have experienced a trauma at an earlier point in their life in one of these joints. It may simply be just osteoarthritis, which may or may not have a genetic component to it, or they may have another systemic disease which has caused the erosion of their joint surfaces, and now they present for replacement of the joint.
Gotcha. Okay, so why would this be something that someone who's getting joint replacement surgery take advantage of?
Yep. So we know that there are certain levels of health in terms of managing blood sugar, certain nutritional components, certain functional components that need to be in place in order for this surgery to be successful. So the reason that you take part in this is that it is a comprehensive team that involves the patient's physician, surgeon, clinical specialists who can do preoperative workups on your blood, and then clinical specialists like physical therapists and occupational therapists who will look at your preoperative level of function. Team gets together, gathers all that information, and determines the health status of the patient is such that they will be successful in their outcome.
So is this taking it a step further? So the moment they realize they need joint replacement surgery, they come here and they learn that basically they don't just get the surgery and then it's over. I mean, it's got to be a lifelong process. You might have to change various things about your lifestyle, correct?
Yeah, in today's class, what we do in the class is it is an education regarding the process of the surgery itself, and then how to prepare it, how to prepare your body in terms of what to eat, what to bring to the hospital. We want the patients to know what to expect, because that alleviates anxiety and stress, and we know that the alleviation of anxiety and stress contributes to the patient's health and outcome as well. So we will walk them through various things, for example, on what to eat, how to maintain infection prevention. We talk a lot about pain control in this class today, and what to expect in terms of managing your pain afterwards. We talk to them about clinically what they can expect on the day of surgery, the day after, and then how do we transition their care? What does it look like once you leave the hospital? And all that is addressed in the class.
So a huge educational component. And let's be honest, a lot of times doctors, and they're busy, they don't have the time really to walk them through.
Correct.
Okay, Tom, tell us about those patients who are skeptical and they just think, I don't need to take that class. What would you tell them?
So that's a good point. And we know in these programs across the country, when a patient misses the class, meaning they're not informed and they don't know what to expect, their length of stay in the hospital is on average 1 day longer. That's what the data is showing.
Which can be super expensive if you think about it, right?
Super expensive, but it's also an indication of their function